workforce safety and wellness. Introduction. Introduction. To take care of others, we must take care of ourselves. Recognition of hazards, personal neglect, environmental and human-made threats, mental and physical stress. These are the hazards that can affect us as EMS providers. General health, wellness, and resilience. Health is a complex interaction between physical, mental, and emotional. Some persons will add spiritual to that, connections. Chronic physical, mental, or emotional stresses can worsen or increase the chance for the developing health conditions. So if our physical, mental, and emotional health is not good, it can put us at risk for health complications. Not all reaction to stress are negative. So you have eustress, which is good stress. It creates a positive response. And you have distress, which causes a negative stress response. Wellness is the active pursuit of a state of good health. Resilience is the capacity of an individual to cope with and recover from distress. And in order to be able to do that, we must eat a healthy and well-balanced diet, ensure a minimum of 7 to 9 hours of sleep, strengthen positive relationships with family and friends. Build relationship with peers and colleagues, incorporate daily stretching, movement, and exercise. Build habits of mindfulness and positivity. Now, strategies to manage stress, and everybody have their own way of dealing with stress. Minimize or eliminate stressors. Change partners to avoid a negative or hostile personality. Change work hours, change work environment, cut back on overtime. And there's a lot of overtime right now due to the COVID surge. Change your attitude about the stressor, talk about your feelings, seek professional counseling if needed. Do not obsess over frustrating situations. What I always say, if you cannot control it, then don't worry about it. If it's something that is beyond your control, can't stress over it. Try to adopt a relaxed philosophical outlook. Expand your social support system, develop friends and interests outside of emergency services. So leave work at work. I have various ways or things that I do to relieve stress. I practice martial arts, which is a nice medium to get rid of stress for me. I will draw, I will write, I like watching anime, like reading manga. These are things that I do outside of EMS, contrary to what a lot of people believe. A lot of persons tend to believe that all I do is EMS, but if I did that, I would probably retire long time ago, right? I would be out of EMS by now if all I did was EMS. So everybody has their their stress release mechanism, but it is necessary because the job can become stressful. The job can become demanding. Limit intake of caffeine, alcohol, and tobacco. Nutrition. Eat regular, well-balanced meals. Limit consumption of sugars, fat, sodium, and alcohol. Maintain adequate fluid intake. Exercise and relaxation. Regular exercise enhances the benefits of good nutrition and adequate hydration. Good physical condition allows you to handle stress more easily. Engage in at least 30 minutes of moderate or vigorous physical activity at least 5 days per week, and you want some type of aerobic activity, strength training, and flexibility if you're going to be exercising. Sleep, very important. The National Sleep Foundation and American Academy of Sleep Medicine recommends 7 to 9 hours of sleep per night. I don't think I've had 7 to 9 hours of sleep in a very long time, but I do rest incrementally. So the most I'll get is probably 4 to 6 hours, but throughout the day, I will rest if necessary for another 2 hours. But I don't think I've ever slept for 7 hours uninterrupted or 9 hours. Half of EMS personnel get less than 6 hours of sleep per 24 hours and report severe mental and physical fatigue. That's very straightforward. If your body is not properly rested, your thought process will not be at its maximum level, and you'll make simple mistakes. We don't want to make simple mistakes when we have a person's life in our hands. Evidence-based guidelines for fatigue management have been developed under the US DOT and through the National Association of State EMS officials. Recommendations to combat fatigue. Get an adequate duration and quality of sleep. Take 20 to 30-minute naps during shift work. I definitely do that. Increase physical activity. Be careful about caffeine consumption. It can cause you to develop high blood pressure. It can make you restless. Engage in mental exercise. Avoid caffeine and nicotine for at least 4 hours before bedtime. Ensure your sleep environment is dark, quiet, and cool. Exercise early and allow enough time to relax. I normally work out in the evening or afternoon. Some persons work out in the morning. Whatever works for you, go with it. I'm not gonna say this is the right way, this is the wrong way. Whatever works, go with it. Avoid heavy pre-sleep meals, balance fluid intake. Establish a calming pre-sleep routine. And for me, it's gonna be reading something. So before I go to bed, I'm gonna read something. Or if I'm preparing to sleep, I'm gonna read. And usually it's a manga, right? Yeah. Sleep when truly tired. So if you're tired, the only way to fix that is to sleep. Don't watch the clock. Keep a consistent sleep schedule. Expose yourself to natural light during your waking hours. All right, now let's look at disease prevention and health promotion. Disease prevention focuses on medical care and prevention to avoid the effects of disease. Health promotion focuses on personal practices and social habits to improve one's health. Smoking, vaping, or chewing nicotine can lead to cardiovascular and respiratory illness as well as cancer. Major problem in the States. It's hard to say if it's a major problem here. I would tend to say it's not, but we do have smokers here in Jamaica. Strategies are available to assist with quitting nicotine containing products. Alcohol abuse, definitely a problem here in Jamaica. Acceptable alcohol consumption is described to be 1 drink per day for women and 2 drinks per day for men. Excessive alcohol use can adversely affect many body systems and increase the risk of developing certain cancers. Drug use, major problem in the States. Both prescription medications and illegal or illicit drugs may be abused or misused. Many EMS agencies drug test their employees for illegal and prescription drugs. Balance in work, family, and health. Rotate your schedule to give yourself time off. Time off is important. Take vacations, that is important. Seek help when stress becomes more than you can handle. Infectious and communicable disease, the bane of our existence for the past, from 2020? Yeah, 2 years. Infectious disease is caused by organisms within the body. Communicable disease can spread from person to person or from one species to another. So basically, every communicable disease is an infectious disease, but not every infectious disease is communicable or contagious. Now, infection risk can be minimized through the use of immunizations, protective techniques, hand washing, terminologies that you need to be familiar with: pathogen, contamination, exposure, and PPE. I'll allow you to read up on that. Routes of transmission. So routes of transmission include, it can be direct, indirect, airborne, foodborne, vector-borne. So direct contact, blood-borne pathogens; indirect contact, needle sticks; airborne transmission, example sneezing; foodborne transmission, example contaminated food; vector-borne transmission, fleas, mosquitoes. Risk reduction and prevention for infectious and communicable diseases. All EMTs are trained in handling blood-borne pathogens. The CDC developed standard precautions, and hygiene is extremely important. So we have to wash our hands, we have to keep our hands clean. Personal protective equipment: gloves, gowns, mask, eye protection, face shield. And in the inception of EMS, none of this was available. A matter of fact, the messier your uniform was, it was a sign of pride. Those things are no longer done, right? So based on the situation, your assessment of the situation, use the most appropriate PPE based on the situation. And once you have completed contact with your patient, ensure that you wash your hands. If you're washing your hands on a regular basis, your skin is gonna crack, so you need a moisturizer for your hands. Now, donning and doffing PPE. Donning is putting on full PPE. Doffing is removal of full PPE. Perform in a consistent sequence to reduce the risk of contamination. So it's done a specific way to avoid contaminating yourself or others. Proper hand hygiene. Hand washing is the simplest yet most effective way to control disease transmission. Wash hands before and after patient contact, even if you wear gloves. If there are no running water, use a waterless hand washing substitute. Gloves. At minimum, always have on your gloves before you make contact with a patient. Wear gloves if there is any possibility for exposure to blood or body fluids. Vinyl, nitrile, and latex gloves are effective protection. The latex glove is rarely utilized now in EMS because of persons having allergies to latex. So you're not going to see that a lot anymore. You might see it in Jamaica, but in EMS systems outside of Jamaica, you'll rarely see the latex gloves being used anymore. Removing gloves requires a special technique. Avoid contaminating yourself with materials on the outside of the gloves. Eye protection and face shields. Any patient that you suspect has any type of respiratory tract infection, whether it's upper or lower, you want to ensure that you protect your eyes, your nose, and your mouth. And if you're going to be doing any type of airway management, eye protection, and face shield is essential. So eye protection protects from blood splatters. Prescription glasses are not adequate. Goggles or face shields are best. And with the COVID situation, there is a shortage of PPE right now. Now, gowns provide protection from extensive blood splatter or fluids. Worn in situations such as aerosol generating procedures, like if you're going to suction a patient's airway, then it might be ideal to have on a gown. Field delivery of a baby, patient with major trauma. Depending on circumstances, you might not get the opportunity to put on a gown. So it's good to have a backup uniform wherever you work. So you might not get the time to put on a gown in all circumstances. If the time allows, go right ahead. Now, masks, respirator, and barrier devices. Standard surgical masks are for fluid splatter. Surgical mask on a patient with communicable disease. Mask with a particulate air respirator on yourself if disease is tuberculosis or you suspect that it is some type of respiratory tract infection, because most communicable disease will present as cold or flu. So you definitely want a N95 or a K95 mask. And if you're going to be using these types of masks, it has to be fit tested and seal tested. You can't just take out one and start wearing it. Don't work like that. And I think that's why the Ministry of Health is avoiding pushing that for the public, because it requires fit testing, seal testing. You can't just put on a N95 or a K95. It doesn't work that way. Now, mouth-to-mouth resuscitation may transmit disease. Now, that's not something that is routinely done in the pre-hospital setting anymore. It's something you may consider for a family member or a loved one, but it's not something that we do on patients anymore. With an infected patient, you're going to use your pocket mask or a bag mask device. Pocket mask is a very important tool or equipment that you will need as an EMT. I would recommend that you invest in one. Dispose of these devices according to local guidelines. Proper disposal of sharps. Proper disposal helps to avoid HIV and hepatitis. Do not recap, break, or bend needles. Dispose of used sharp items in an approved closed container. Employer responsibility. No guarantee of 100% risk-free environment. That's not guaranteed. Risk of exposure to communicable disease. I do not take questions during my lecture. No guarantee of 100% risk-free environment. Risk of exposure to communicable disease is a hazard of your job. Follow OSHA and other national guidelines. Know your department infection control plan and follow it. Again, people, write down your questions, ask them at the end of the lecture. I do not take questions during my lectures. Establishing an infection control routine. Infection control should be part of your daily routine. Clean the ambulance after each run and on a daily basis. Make sure that you clean any equipment, any personal equipment that you have as well. Cleaning should be done at the hospital whenever possible. Immunity. Even if germs reach you, you may not become infected. You may be immune. Preventative measures, maintain your personal health, receive immunizations. Some of these immunizations may require boosters. The CDC recommends immunizations for, so these are the immunizations that are recommended by CDC if you're going to work as a responder in the States. Hepatitis B, and you can get hepatitis A and B together now. Influenza vaccine on a yearly basis, measles, mumps, and rubella, varicella vaccine or having had chicken pox, tetanus, diphtheria, pertussis, and you're required to do a skin test for tuberculosis, and if it's positive, you have to do a chest x-ray. General post-exposure management. So if there is exposure, if you are exposed to a patient's blood or body fluids, turn over patient care to another EMS provider, clean the exposed area, rinse eyes if necessary for 20 minutes, activate your department infection control plan, complete an exposure report. Now, scene safety. Scene safety begin by protecting yourself as soon as you are dispatched. Continue to protect yourself once on the scene. So your personal safety comes before everything else. So personal safety for yourself and your crew members. Then you can start think about patient and environment. If you recognize that your scene is not safe for you to function effectively, then you need to request whatever resources are necessary to make that scene safe for you to work. Now, hazardous materials. Identify what you can from a distance. Do not enter unless safe to do so. And the U.S. Department of Transportation has an emergency response guidebook that lists hazardous materials. It will tell you the type of hazardous material, what it does, the distance that you need to be away from that location. Now, if it's a hazardous material situation, you should be so far away from that location that you need a binoculars to see the location. And there needs to be a hot zone, warm zone, and a cold zone. The cold zone is where EMS will be. The hot zone is where persons who are properly trained as hazmat operation technicians will be. And the warm zone is where the patient is decontaminated. As EMS responders, you do not make contact with the patient until the patient is properly decontaminated. Now let's look at some specific hazards. Electricity. This is beyond the scope of EMT training. Mark off a danger zone. Be aware of lightning. Now if there is a down power line, you can't go there and move that power line. If it's live, you need to call the power company to cut the power to that line before you can make contact with the patient. For lightning, a repeat strike can occur, and it can be either direct hit or ground current if possible, is possible. And usually when an area becomes charged before a lightning strike, the hairs on your body are gonna stand up. And lightning is gonna hit the highest point, that's a conductor. Fire. For fire hazards, this could include smoke, oxygen deficiency, high temperatures, toxic gases, and building collapse. Use proper protection. And really, this is the fire service role. So if fire hazards are present and it's outside your scope of training, then the fire department need to be contacted. For vehicle crashes, these are common events for EMS providers, things that you need to be mindful of: the flow of traffic, unstable vehicles, down power lines, sharp objects. Use protective gear. Again, you may have to request the services of the fire department if you don't have the proper training. Let them and the police secure the scene or whatever hazards are present. You may need the fire service to create access to the patient as well. Now, scenes of violence, assaults, hostage situations, riots. For mass violence, know who is in command, remain vigilant for the potential for violence, allow law enforcement to clear the scene. At scenes involving projectiles, find protection, cover, concealment. Recommendations for preventing violence. These are recommendations. Note the word recommendations. It doesn't mean that if you do these things, it's going to work. Now, training and practice identifying scenes of potential violence, training and practice with de-escalation strategies and techniques, training and practice improving interpersonal communication, dispatch identification, and alerting of past or potential threats of violence. Training and practice in self-defense and escape techniques. And self-defense in this situation is really creating distance between you and the individual and getting out of there. That's the best self-defense. Training and practice with physical and chemical escape techniques, fitting and the use of body armor. Training and practice in operations with law enforcement. Now, protective clothing, preventing injury. Critical to personal safety. Become familiar with various types. Cold weather clothing, which have 3 layers. Turnout gear, that's the firefighting gear. Protect against heat, fire, sparks, and flashover. Gloves, which protect against heat, colds, cuts, may reduce dexterity. Helmets protect against falling objects, and steel toe boots are preferred. Eye protection would be your your goggles or glasses with side shield, ear protection, foam, earplugs, skin protection, sunblock, body armor, this. And the body armor is not standard. It's something that they are looking into in the States, but it's not standardized as yet. It's really for tactical EMS response. Caring for critically ill and injured patients. Let the patient know who you are and what you are doing. So communication is going to be essential. Let the patient know you are attending to his or her immediate needs. Communicating with the critical patient, avoid sad and grim comments, orient the patient. So you may have to explain to the patient what's going on, because based on the injury or illness, they might not be aware of what is happening. So you may have to break it down, be honest, deal with possible initial refusal of care, allow for hope, locate and notify family members. Do not lie to your patient. Ask a responsible adult to accompany the child, and that's for your injured or critically ill children. Death of a child is going to be a tough one. It's a tragic event. Help the family in any way you can. Let the family's actions be your guide. Prepare the parents. And in my career as EMS, pediatric calls are the calls that make me nervous as a medic, right? So these are difficult calls. Death and dying. Death occurs, so we can't save everybody. You're gonna lose some patients. It can be quite suddenly, can be after a prolonged terminal illness. The EMT will face that, so it's something you will have to face. And you won't know until it happens, right? So you'll know how you will respond to it when it happens for the first time. And stages of grieving that you need to be familiar with: the denial, anger and hostility, bargaining, depression, and acceptance. You can do some additional reading on that. The EMT's role: ask how you can help, reinforce reality, be honest, allow the patient and family to grieve. Words of comfort when responding to grief: I'm sorry for your loss. It's okay to be angry. It must be hard to accept. That must be painful for you. Tell me how you are feeling. If you want to cry, it's okay. People really cared for so and so. And if you have nothing positive to say, say nothing. Now, stress management on the job. EMS is a high stress job. It really is. Important to know causes and how to deal with stress. And you have what is referred to as the general adaptation syndrome, where there is an alarm response to the stress, then there is a reaction and resistance, then we have the recovery or exhaustion stage. And this response can be accompanied by physiological changes or findings. So physiological signs of stress would include an increase in respiration and heart rate, an increase in blood pressure, cool, clammy skin, dilated pupils, tense muscles, increased blood glucose level, perspiration, decreased blood flow to the gastrointestinal tract. Now, situations that can be stressful: dangerous situations, physical and psychological demands, critically ill or injured patients, dead and dying patients, overpowering sights, smells, and sounds. Multiple patients, angry or upset patients, family or bystanders, it will happen. Unpredictability and demands of EMS. Now, the acute stress reaction, this occurs during a stressful situation. The delayed stress reaction manifests during a stressful event. Manifests after a stressful event has ended. And the cumulative stress reaction is a prolonged or excessive stress situation. Now, physical symptoms of stress: fatigue, changes in appetite, GI problems, headaches, insomnia or hypersomnia, irritability, inability to concentrate, hyperactivity, underactivity. Psychological symptoms: fear, dull or non-responsive behavior, depression, guilt, oversensitivity, anger, irritability, and frustration. Critical incident stress is caused by an acute severe stressor, and it's usually going to occurs after 72 hours of a stressful event. It can be due to a mass casualty incident, serious injury or traumatic death of a child, crashes with injuries caused by an emergency provider while traveling to or from a call, death or serious injury of a co-worker in the line of duty. These can trigger critical incident stress. And this can lead to post-traumatic stress disorder, which is where the responder keep reliving the issue. It may develop following a psychologically distressing event characterized by re-experiencing the event or over-responding to stimuli that recall the event. Critical incident stress management. This is used to help providers to relieve stress. It can occur formally or at an ongoing scene facilitated by trained professionals. And psychological first aid is preferred over critical incident stress debriefing. Burnout is a combination of exhaustion, cynicism, and reduced performance resulting from long-term job stress. It affects the well-being of EMT along with that of crew members and patients. Compassion fatigue, also known as secondary stress disorder, characterized by gradual lessening of compassion. Symptoms include high absenteeism, inability to work in teams, lack of empathy for patients, judgmental attitude towards patients. Responder risk for suicide. Suicide rate among emergency responders is higher than the rest of the population. Job stress is considered to be the largest contributing factor to suicide. Several organizations and mental health services are available to provide emotional support. Emotional aspects of emergency care. At times, healthcare providers have trouble overcoming personal reactions and proceedings without hesitation. It's going to happen. The struggle to remain calm in the face of horrible circumstances contributes to emotional stress. So there are situations that you will face that you have to remain calm at that point, or you must give off the perception that you're calm. But after the call ends, it is something that you will think about. It is something that can stress you out. So Having a stress release mechanism is going to be very important. Stressful situation. Many factors influence how a patient reacts to stress of an EMS incident. Quickly and calmly assess the actions of the patient, family members, and bystanders. Use a professional tone and show courtesy. Allow the patient to express their fear. Respect religious customs and needs. Workplace issues. Cultural diversity on the job. You are expected to work with co-workers of varying backgrounds, beliefs, and values. Culture include nationality, age, disability, sex, sexual orientation, marital status, work experience, and education. Communicate in a way that is sensitive to everyone's needs. Remain curious and open-minded. Sexual harassment, there are two types: quid pro quo, request for sexual favors; hostile work environment, jokes, touching, etc. Report harassment to your supervisor immediately and keep notes. Substance abuse increases risk on the job, leads to poor decision making. Seek help or find a way to confront an addicted coworker. There are employee assistance programs that are available to assist employees who have substance abuse issues. Injury and illness prevention. Program should contain management leadership, worker participation, hazard identification and assessment, hazard prevention and control, education and training, program evaluation and improvement. And that would be the end of chapter 2.